Hi, Dr. Eric Murphy here, talking to you from my Round Rock, Texas spine clinic. If you'll excuse the way I'm dressed today, I'm in my scrubs, I'm in my work clothes. When I first started thinking about doing this informational video, the people in the know said that I needed to wear a suit and a tie and I needed to hire a professional videographer to come in and make sure everything looked perfect. And I said, I really don't have time to do all of that stuff. I'm here, I'm taking care of my patients. Right now, I have a house full of people out there waiting to get treated. They're on their therapies, and I'm in between patients right now. So I wanted to take a couple of minutes and just talk to you about a therapy that is keeping tens of thousands of people across the country from having to have ineffective, expensive, dangerous spine surgery. Here in my clinic, we treat some of the most severe spinal injuries, including herniated discs, disc degeneration, and spondylolisthesis. A herniated disc is when the disc starts to bulge out and it pinches on the nerves. Disc degeneration is when the discs get thinner and thinner, and as they get thinner, the bones start to clamp down on the nerves, which in turn pinches the nerve. Next is spondylolisthesis. Spondylolisthesis is the most severe injury of all three of those. That's when one vertebrae slips forward on the vertebrae below. When it slips forward, it pinches the nerves on the side. These are all conditions that we treat effectively here in my office without the use of surgery. These types of injuries can cause a multitude of symptoms. Some of the most common symptoms from these types of injuries is going to be neck or back pain. Some people will have radiating pain down the arms or down the legs. Some others may have numbness and tingling into the arms and legs. Now, not everybody has all of those symptoms. Some only have one of those symptoms. Others may have a combination of those symptoms. Another symptom of a pinched nerve is migraine headaches. Migraine headaches are caused from a pinched nerve in the upper cervical spine. That nerve wraps over the head, and that's what causes that pounding pain that goes over the top of the head. So yes, we can even help people with migraine headaches. When you have radiating pain, numbness, or tingling, that's a sign that the nerve is severely pinched. Nerve tissue is very sensitive to pressure, and it doesn't like to be pinched off. The longer that nerve is pinched, the more damage it does. You'll start getting muscle atrophy where the nerves go into the extremity, which means the muscles get smaller and weaker. If it's left pinched long enough, that can even lead to paralysis. Now, we have patients that drive here from over 2 hours away, and it's because we get really great results here. Most of the people coming to our office have already tried things like physical therapy, massage. They've even been to other chiropractors. I'm a chiropractor, but I don't practice like most chiropractors. So they've even tried chiropractic. They may have already had spinal injections. Some, unfortunately, went ahead and had spinal surgery. Now, they're out of surgery. They have a $60,000 to $100,000 spine surgery bill, and they've still got their pain symptoms, and they're looking for another way to try to take care of it. Thankfully, for a lot of those people, we're able to help them even post-surgically. Now, these people that come to me are in so much pain, they no longer really enjoy certain aspects of their life, if any of it. They can no longer take care of their families. They can no longer take care of their kids. They don't enjoy doing their hobbies because they're in so much pain. Out of the thousands of cases that we've treated here, a couple of them come to mind. The first one, a gentleman came to us and he had worked his whole life to retire. He had saved and put away. He wanted to retire and play tennis the rest of his life. Shortly after retirement, he hurt his neck and he started having severe pain, numbness, and tingling down his right arm. He went to the chiropractor, he went to acupuncturists, he even went to medical doctors, had spinal injections with minimal to no results. Thankfully, one of his medical doctors referred him over to us. After a couple of months of treatment, we were able to get him pain-free. He's now enjoying retirement and getting to play tennis. Another patient was a mother of three small children. You know how demanding small children can be. They consume a lot of your time, and we love doing that. But she was in so much pain, she couldn't take care of her kids. She couldn't take care of her husband. She couldn't make dinner for them anymore. She couldn't play with the kids, which they didn't understand. They were so small. All they wanted to do was to have mommy come and play with them. They didn't understand why mommy was in bed all the time sleeping, and it was because she was just trying to escape the pain. Finally, her medical doctor referred her to our office for care. After a couple of months of care, we were able to get her pain-free. She's now taking care of her family. She's playing with her kids. She's enjoying life again. Most of the people that come to us, they come to us with severe pain symptoms. And after going through our spinal rejuvenation program here, they're back to spending time with their families. They're back to spending time with their kids. They're back to doing the hobbies and the things that they love to do. Now, most of you that are watching this video, either yourself or someone you love, has one of these injuries, or you have one of these symptoms. You may have even tried using things like physical therapy, massage, chiropractic, spinal injections, or surgery. And unfortunately, that didn't fix it. You were on the right track with these types of therapies, but there was a few missing links. One being the combination and the amounts of each of the therapies that we do. The main thing missing was spinal decompression. Spinal decompression is the primary therapy that we use to be able to save people from having to have surgery. Now, we've saved thousands of people from having surgery using spinal decompression. Imagine how your life will change if we can treat your spine, get it healthy again, get pressure off of those nerves that are causing that severe pain, the numbness and tingling, get you back to living your life. With spinal decompression as part of our treatment program, we have an 86% success rate in treating spinal injury. Now, if you compare that to spinal surgery that only has a 25% success rate, then 86% success is pretty good, and it's a lot less expensive than spinal surgery and a lot less painful and a lot less recovery time. No recovery time, actually. Now, you may be wondering what spinal decompression is. Spinal decompression was discovered back in the 80s with NASA, as a matter of fact. So the scientists that worked with the astronauts noticed that when they went into space, that a lot of their symptoms like neck and back pain and numbness and tingling went away once they were in space. So they started looking into that and researching it, trying to figure out why that was happening. And what they found was that that lack of gravity allowed the discs to decompress, which got pressure off the nerves. So the scientists started trying to recreate that. And that's when spinal decompression was born. Spinal decompression is a computerized traction table that very specifically and gently tractions out the spine, and it milks it back and forth. That milking action causes the disc material to pull back inside. It also causes disc degeneration to reverse. Now, disc degeneration is reversed because degeneration of the spine means that the disc is dehydrating and getting thinner. You can imagine a dried out old sponge. It's hard, it's thinner than it usually is, and it's brittle. If you put that sponge back into a bowl of water, it'll thicken back up and it becomes pliable. So the discs are the spacers between the vertebrae. They keep the bones spaced out off of the nerves. As it degenerates, it gets thinner and thinner, and it's dehydrating. And as it gets thinner, it starts to pinch on the nerves. With spinal decompression, decompressing that disc, it pulls hydration back into the disc, causing that disc to get healthy and thick again, much like the sponge in a bowl of water. Now, there are some common questions that a lot of people have. Most people have these questions. One is, does my insurance cover it? Unfortunately, insurance does not cover spinal decompression. If you have health insurance, it may help with some of the other therapies that we do in the office, but spinal decompression itself is not covered through insurance. Now, the second one is, well, if insurance doesn't cover it, then how much is it going to cost? And there's really no way I can answer that without first having a chance to examine you, make a diagnosis, come up with a treatment plan, and decide which therapies you're going to need and how much of those therapies you're going to need. So there's no way to give you an exact answer until we actually see you. What I can tell you is that my practice is made up of single moms, retirees, people on fixed incomes or low incomes. So if somebody is interested in getting their spine healthy again, I will make this promise to you. We will do everything. We will find a way to get you the care that you need. So if you can afford even just $200 to $300 a month, then you would be able to afford our treatment plans here. What we're doing for everybody that sees this video, if you call the office, talk to Monica or anybody else that answers the phone, just tell them that you saw this video. Our normal fee for a consultation is $225. If you tell them that you've seen this video, we're going to reduce that from $225 to just $87. That includes anything that we have to do in the consultation, the exam. If we have to shoot any x-rays, it would be included in that. Now, from that initial consultation, I will be able to decide if I feel like I can help you. If I can't help you, I'll tell you. I don't want to waste your time. I don't want to waste your money. But if I can help you, I'll be able to tell you at that time exactly what it's going to cost and exactly how long it's going to take to get your spine healthy again. So give the office a call today at 512-255-9887. Tell Monica that you saw this video and she's going to give you that reduced fee.